Hello, welcome to Universal MD. I'm so happy to be your host today. If you remember from my other video where I talked about how I matched into internal medicine at the University of Calgary, today it's even a brighter day because I'm bringing you live to my screen to show you exactly how my CaRMS application was able to give me those record numbers invites that I got as an internationally trained physician. Well, if you like what we've been doing and you can support us, we'll be so happy. Just hit like, subscribe to our channel, and we'll be delighted to bring you more useful content and show you exactly what we're doing like this. Let me stop talking and take you directly to my CaRMS portal so you can see exactly what I did.
You can come here, say CaRMS online, you just say CaRMS, login, you can say login, and it'll take you to CaRMS login page. Please enter username and password. Perhaps you don't have it and you want to start back all over. Say click here to register. It's going to take you to this page. These are different subspecialty match. So R1 is the main one that everyone has to go through. That's why it's green. This one is a medicine subspecialty match. After you've done 3 years of internal medicine, then you can do like GIM or general internal medicine where you can do this one. And then this is for family medicine. Say after a family medicine training, the physician is intending to go and do some public health or do some gynecology added skills. And then this one is like pediatric subspecialty matching. So you want to be a pediatric oncologist or like a pediatric cardiologist, you can do that. But all of us, you start here. They'll ask you this question: do you already have an account with CaRMS? You say no, and they'll ask you to put in your information here. So you're a doctor. Then your first name can be Drake Line, and then you go here to last name McKevitt, and then your email could be MG abroad. Then a password is going to be sent to that email. You just need to get it back out here. So there you go. And then you can put in that information right here. And boom, it takes you right here. Do you already have account? You said no. So they want you to fill in your personal information. So let's just say you're living in 30th Street, Southwest Ontario, and your city is London, and your country is Canada. You know, your postal code is, and your province is Ontario. You just put it in there. And this is your email, primary phone number. You want to put in a primary phone number. You just put others, and then you put your name of your school. Is the name of your institution, hospital the same as your medical school affiliation? It could be yes or no. You could say, just say yes, and then you go to next. So they want you to include the password. You would just include the password with all the security questions, and then you would have this declaration, which would be the last thing, and then you'll have your CaRMS online account. So UP, that's how you create a CaRMS online account from the beginning to the end. So again, and there's a language options right up here. You can always change that to have your CaRMS account either in French. If you're worried about that, you can just click on it and then it goes to French as well, or you can click on it and it goes back to English. So just like that. Let's say we've created our CaRMS online account, and now we are ready to log in and start doing work on our profile. So then you can log in. I'm going to log into my Unreal CaRMS logging right there. This is, so I'm going to push here on logging. Oh, so you have to fill every component here on the profile, education, examination, experience, and everything here as well, and then everything here, and then you get your result at the end. So it's really progressive. So this is the first aspect right here, which will be personal. Include this personal information for yourself right here, your birthday, this information right here, you'll get it from MCCQE, and then you just include it right here. So right on your MCCQE. So that's about the first page. The second one is going to be language. You'd include the different languages that you can speak. So you can just put Spanish, and then you could add it. I don't think I can add it right now because I'm already done, like the whole match process is over. But then you could include whatever language you can add right there. There's a little plus sign here that you could add it. Licensure, this would be another thing that you have to include. So licensure, and before we go there, so personal information, you know, you could either put that your application is either just in English, French, or bilingual. This is really important. If you're applying to Quebec, then you must put it bilingual. And licensure here. So this is very important. I see lots of candidates make so many errors here. So they say current medical license. Even if you're working as an associate physician, that is not a license here, because when they talk about licenses here, they're talking about licenses that you've worked independently. So this includes permanent, limited, and other special purpose licensing registration. And then you can give the descriptions right here, but they want you to put only a permanent license. So sometimes they can put independent, unrestricted. Do you have an independent or unrestricted license in Canada? For the most part, no. None of us has, since we're applying to CaRMS. Provisional, restricted, or special licenses. Now with the specialty pathway, or maybe for people doing practice ready assessment, they might. But if you're an associate physician, this is not for you. So it's just going to be none here. Do you currently have a provincial postgraduate licensing certificate? It's going to be no. If you ever had a Canadian medical license, it's going to be no, except you become a specialist in Canada, say family doctor before. Now you're doing CaRMS again because you want to be an internist, then they would be yes in that situation, but and then you have to explain and give different things. But it's no in our case. Have you ever had a medical license outside of Canada? Yes. In your home country where you have your medical license is years, and then you say the date that you obtain your license. Is your license still valid till now? Yes. And then you do a brief description. So I just did a brief description here: name of my country, permanent license number, that, and then I said as a general practitioner in my country, my role includes broad scope primary care services such as routine examination, diagnosis, and management, which is like the broader scope of a doctor's job. And you just write some basic things, and you can write about your other associate physician job here. So you get one, you can write out better provisional license number this, College of Physicians and Surgeons of Alberta, or a different one, and then you just give a brief description of your scope of service, but essentially that is what you're supposed to do here. And then if your application is bilingual in French, then you also have to do the same thing here in French, which is just like translating everything that you've done in English into French if your application is like mine. So that is it for this page. Please not do any other thing here. Don't say I'm an associate physician, I need to add anything here. Of course not, you don't have to. Next one is non-medical education. So your non-medical education with the things that you've done that are not medicine. So again, it'll be graduate level, country, institution, city. I did a business degree program once I reached here back in 2022, and this is just it I included here. That's all. That's the only thing I've done outside non-medical. And medical part is gonna come right here. So where did you go to your medical school? Sometimes if you've done multiple medical school, CaRMS says if you need to update your date of graduation, or if you've attended more than one medical school, please send an email to CaRMS. That way they'll configure your application to add a second medical school. But for the most part, many people have their MD degree from one school. So you just put your MD degree here. That's all you need to include here. And so it's number of medical schools you attended is 1. In the case where you attended multiple, you put here 2, right? But it's just 1. And then city and a place where you attended. Attendance start date is right here. And then you just complete a few information about your school. Medical school is 7 years. Say how medical school is in your country. Then the next thing here is undergraduate clerkship. Okay, so enter all clerkship electives provided by your medical school taken during your undergrad medical education, not including core rotations. You should also enter future scheduled electives. You can enter all these different things. And so these are the different things that I did for undergraduate clerkship. That means between, if you're medical school, you go after a bachelor's degree, then the mean from your 4th year to your 6th year. If you're medical school, you start from 1st year in the university till the 6th or 7th year. Then all those things that you did within those years, these are the things that they want you to write it here. And ideally write it the way it is in your school. So the discipline, the country, the university, the city, supervisor, if you can remember the names, it would really be good because it's an asterisk, so you have to complete it, start date and end date, and the things that you did is not very compulsory. You can leave it empty. It's some places where I left mine empty, and here look at I'm writing just very few words. And then you do the same for all these other different things. This is for psychiatry, writing like really very few things here. Just for psychiatry, gain clinical experience in mental health and how to assess, diagnose, and manage them, these different conditions. So again, just these different things. And that was for undergraduate. Now postgraduate training. It will be after you've graduated. So enter any accredited postgraduate medical residency or internship. So those people who do housemanship, which counts as an internship. So you want to look exactly where to put it. If your internship or your housemanship, it was necessary for you to be able to graduate, like it was a mandatory requirements for you to be able to graduate and gain your MD, then you do not include it under postgraduate training. You include it under clerkship electives, like before you graduate. But if you had graduated and you had your title MD before you then did the housemanship, or you then did a 1 year after or 1 year internship, then that will be considered as postgraduate internship. Then here is actually where you put it. So for me, actually, after graduating, I did two things. I did internal medicine and then I did general surgery in two different countries. So internal medicine was in Japan right here, as you can see. And these are the years that I did and I completed. It was just a 1 year program. And then general surgery too was like back home. So again, include these different things, and that'll be for postgraduate. Residency electives. During residency, then what are the things that you did? So during residency, this is in Japan. This is what I was doing in Nagasaki with my professors, is to ask you the same question. Discipline, country, university, city, supervisor, start date and end date. You must include this, and it's the same for all these different things that I did for both back home and in Japan. If you did it just back home, just do all the ones that you did back home. It's just electives. And then you go to non-clinical training. Anything that you've done that's non-clinical training, say maybe you've had like a master degree, you've had some trainings that are online that you feel like they're accredited or credited awarded courses. So this will be it here. So they say enter any non-clinical training certification, any clinical training like, basic life support BLS courses that you've attended. Any IMG assessments should be entered in the examination section. So don't include your examination here, like, if you've written the MCCQ one, don't add it here. It's not important. It's not necessary here. Complete this section, and it's not mandatory as well. If you did not do any of these things, you don't have to put it. But I had done courses like on advanced cardiac life support, remote sensing in Japan, project cycle management, design and interpretation of clinical trials. I did this one in the US at Johns Hopkins, biosafety training, séminaire de master, basic life support, Canada Heart and Stroke Foundation approved, all these different things. So essentially this section is a section for continuous medical education. So you include every of those things here. I did a training online with Quebec, and I just put it here. So it's a non-clinical training or certification that you did, the date, the country, and then the description. I did it bullet point. Cervical artery dissection, what's new? That was what we were discussing about. For or against closing a patient for a ovale in patients over 60 years old. And again, it was a debate. So this is all the non-clinical training that you must have done. Non-clinical training. You come to examinations. This is very, 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 very important. I've seen where a candidate has forgotten to do this step and they completely did not apply for CaRMS at particular session because they missed this part. So this is really very important. Make sure you link your physician apply to your CaRMS application, because the result of your MCCQ1 and your NAC would automatically be important, including your result statement. So you cannot directly add it or upload it yourself. You have to link it because they must confirm the validity of the result. So how you do that is by pushing right here on connect. And then this is going to ask you that it wants to connect to your physician's apply account like this, physician's apply and see. Then you would log it with your information right here, the password. It will tell you once you're in here that connect and share, and then you pick the things that you want to share. So you share your MCCQ1, your NACOSK, and you click finish. It's going to return here with you, but it's going to include already your results in your MCQ1 results right here and your different statements right here. So that's what it does. Now, this is also a very important step. So they ask you if you're doing the United States medical license exams. So if you've done, they put it here. So you've done the USMLE step 1, you'll put your status, is it pass or fail, awaiting result, and then you take the date that you took the result, and then you would save it. Ideally, you would save it. So, but I did not take the USMLE yet at the time when I was applying, so there was no need for me for this one. But again, there are some programs that, would accept the USMLE results, and that would actually count towards your CaRMS application. So you want to add that, but you don't have to overly emphasize on it when you're doing your interviews or so, because CaRMS they want to argue that, okay, so Canada is your backup plan, it's not even your number one priority. And no one wants to feel as if they are not the top priority, right? So everyone wants to feel desire. So the programs want to feel that you actually desire, you so much badly want to get into the system in Canada. So the next thing here would be your language proficiency. You must include your language test here. I took CELPIP and this is it that I added here. So you must put the name of the test, the status of the test, is it taken or still awaiting result, when did you take it, the different scores that you had in the exams. Next, you would go to your different assessments. Ideally, before you apply, so there's just going to be these different assessments. If you did a IMG, that's for residents, where in Alberta, you would have information right here about that. And if you did not do it, you wouldn't have it, or you would add it yourself, because normally there's a plus button for you to add the different things. You see, I could add maybe this one for Quebec. I can just add this date, something like that, and then I can put enter, and then that becomes a part of it. Ideally, then there'll be a save button, but since this is already post-match, that's why I am not able to do anything. So again, that's how you add this different assessment. But enter any province at assessment that you've done. It's usually BC CAPS that you have to do here in the AMG program. And then for those who are in Quebec, the CIDIS program. So then you go to certifications, and for the most part, no one has those certifications. Enter any certification exams that you have taken in order to be able to practice medicine in a field or discipline. Completing section is not mandatory, so I had no certifications here, so I just let it be empty. I had not done any certification, and certification here would be like, LMCC. I had not done that. So again, this was me in the process, so I did not add any certification there. Now, situational judgment test, before that, ideally this place will be empty before your exams, but after that, then you would have this result in the course of your application. So to be for FM Pro C, if you want to apply for family medicine, and it has become a mandatory requirements for the entire Canada for everyone applying for family medicine programs, they would just send your score directly to CaRMS, so you have nothing to do and you can only see your score here. So I took that test, and as you can see, my score here was 480. The median score for people of my year, the 2024, who wrote the exams, the mean score, which is the average score, was 424. And then the median was a score that lied exactly, almost in the middle, was 240. And then to pass the standard deviation to really have a good of having a top score was plus 40. So which means that on the mean, you had to add 40 marks here. So the standard deviation to really have a high score was 424 plus 40. So that should have given you 464. So I was way, way, way above. So I was one of the top percentiles for those who took the test for my cohort. And again, it was the same thing with the CASPER test as well. So again, try to do well on this situational judgment test. It really helps you to enhance some of your application. And so again, for people who are looking for mentorship and tutorship, even on the, for your FM Pro C, for your Casper, we're here to help. I can support you. You can just go on the website and you book an appointment, and we'll be right there to support you. So again, you don't have to worry about this once you start applying. The windows will open, you'll receive information once you have started your application CaRMS, and then you follow from there. Then you go to your work experience, which is again, what you've been working. And here again, it's clearly said here that any undergraduate clerkship or clinical practice as a physician of care should be entered in the appropriate section. So here, if you're working in the hospital as a doctor, then you don't enter that information under this work experience. You will definitely enter that experience under your clinical practice. But here, work is something completely different from clinical practice. So work here is any other thing that you did. For instance, I was in different I did research assistant job, co-founded a certain little company called Success Academic Operation. Again, it was a mentoring and a tutoring group like we're doing right here. But again, all of these are just associate physician position as well. So all of these are just jobs that are not clinical practice or independent clinical practice. This one might sound like independent clinical practice, but it's not. And again, you can just translate all these things into French, and that would make for it. And then here you come to scholarly activities. So this one, very, very important. If you've ever been in a research lab for a single day and you assisted in any project, be it a grandiose or a very small project, write it down here. Anything. If someone asks you to do a literature review about some topic that you are intending to carry out a research on it, write it down. That is scholarly activity. If you presented at a conference, write it down. If you joined a seminar, write it down. If you were able to do a poster presentation, write it down. If you receive an award for some, peer-reviewed article that you did, write it down here. If you were a member of a journal club and you guys often review, articles in detail with the different things that you did right here. So these are the things that I did. These are the publication that we had, Urban Public Space Initiative. This one was just done in 2024. I was one of the people who did it. And then this one again were my publications that I had. So this one I was published in PLOS One, and then quite a few other different things I had joined, including attending seminars in the US and abroad and many different places. And then, I even included in the name of this channel, included Universal MD as a scholarly activity. On Universal MD, I do research, I look for opportunities that are available there, be it how to get a job, how to integrate in the healthcare system in Canada, how to run your finances as a physician, be it all those resources and tools on how to ace your QE1 and your NAC. All these different things were things that I did research on to give you tangible, true information according to the best of my ability at the time. So again, these are all the things, so you must include it right here. And then you go to volunteer opportunities. If you've ever volunteered in any way, volunteerism is really important on your CV. This will be a big factor on your CV. So make sure you volunteer. Make sure you add all this information on your CV. So I volunteer for door knocking and pillow head for the government of Alberta. You don't really need to write many things here, but I was not writing depending on how interesting it was. And volunteering, helping to teach, volunteering as a board and as a judge for the Calgary Youth Science Fair. I felt like this was important for me, where we're judging science students' projects. So essentially, all of these things, this should just be what you should do. I did volunteer back in 2013 for the Flying Eye Hospital, so I included all of that information. Now you come here as well after volunteering, you go to clinical practice. This is now working as a doctor where you're seeing patients, talking to them. And this was mostly my independent clinical practice, and that's why this one comes from home. This is the only things that I did home. Nothing else where it would be included here. Because even when I included this, I was called and say I should remove it. So this doesn't really apply here because you don't have a license. So this section is intended for current year medical graduate or enter your clinical practice experience you have, which may include paid or unpaid work. Clinical practice experience is defined as independent practice, practicing medicine as a physician of care without supervision. So, and then again, fellowships. If you've done fellowships, say you've had a degree in your home country and you've come to Canada or the US and you've done a fellowship, then you can include it here. I had none, so that's why mine is empty. Publications, I had done a few publications. Remember back here on research, I put the research activities that we actually did, and then the ones that ended up being published, these are the ones that I put here. So I did a presentation of seminar, I still put in the details. So some of those details from the other area of research, I copy them and I bring here. It just translates directly here. And I say if it was published or not, if it's like a presentation or not. I just say that right here. And these are the different things that I had done. So please include all of these different things. And then achievements and your interests. So this is a time where you put in your hobbies. These are some of the things I've done. I've received some awards. So include your awards. If you've been awarded best student in your medical school, if you're awarded president of Women's Association in your country, if you're awarded best female doctor of your hospital, of your unit, if you're awarded the most assiduous, employee in your office, if you're awarded and recognized as the cleanest person in your community or anything whatsoever you've been awarded. If you've been awarded like a best cook in a local competition, if you were awarded a cup of being a championship or a medal of being the best runner in your local community or your local marathon, then you have to put it here. So all of those things, it doesn't have to be medicine, everything, including medicine. if you were awarded a travel grant, say Young Investigator Research Award grant, if you were awarded travel bursary, exemption to not pay because of your excellent or outstanding application or academics, then all that information you want to include it right here. If you're a member of committee, so you're a member of an IMG group in Ontario, member of the Black IMG community, member of the Muslims and the Imam community, for doctors, members of the female coalition, something, whatever membership you're part of and that you think that can be important and makes sense and is something that, you know, is supported by the Canadian society, you can include it right there. And then your interests as well. So some of the things that you've, like, I'm interested in playing the guitar and playing music and reading, you know, business books and self-development books. So all these different things, please include them. It doesn't look at I had as many as you can see right here. So that will be your interest and achievements. So good. Then the next part will be your personal letters. So your personal letters will be for different programs that you're applying to. So you can include a few personal letters here, which will mean that, for instance, say I pick UBC internal medicine and I open it and then you write it here. So you must make sure that your letters follow because they'll actually count all this letter and make sure that it meets the criteria that was asked in the program description. So, and again, the computer automatically counts it when they are looking at it. So just make sure that you do not mess up. And as you can see here, these were just kind of like personal statements for some of the programs that I wrote that I was thinking of applying to. Yeah, so mostly internal medicines, as you can see right here, internal medicines, few family medicines there, but like general surgery as well. These are just the main programs. And so that should be it. And then reference request, you can request a letter from preceptors. So I asked for letters from many preceptors because I didn't want to be disappointed in the end. But you know, there you go. I had quite a few letters from many people who actually were happy to send me letters. And again, you'd go in here and you would complete some information about these different preceptors, which is really good. And so you can then add other documents. So additional documents is, let me say I want to add my CV, upload it into CaRMS. I'll say CV, then I can take whatever kind of thing. If it's not language, assessment, examination, transcript, then I can say extra document. What kind of extra document it is? A custom CV that I've done. Then what's the language of the CV? It's in English. Then I can, you know, you can choose a file from my computer. That's how it works. And then at the end, you would upload it. So that's how you add a document. You know, you could track documents that you've added already. So let's say I added a document, then after here, I could see all the documents that I had added and the documents that people had added as well. So you could track those documents here. You could literally see here. So it could be like what kind of document it is. It is like an abstract on my publication list. It is an alternative of my language proof, or it is an application support form, because certain programs have application support form. It could be my CV in these different things. And then it showed the language in which the document is. Is it English, French? Is it bilingual? And then it showed the status. So again, the dates will change based on how you've evolved in the CaRMS. You know, a green check will mean you've submitted it or not. And so you don't have to worry about that. But this is like post CaRMS that I'm showing you when I've already done all these things already. Then if you wanted to do a translation request, say you want to apply in Quebec, but you want them to translate some of your documents, you know, you could, there's a button you could push, and then you could say, I want to translate my CV or my personal statement into French. And then you pay at the end, and then they'll translate it for you. So saying the translation request no longer exists because the whole thing is complete already. All right, and then there's a CaRMS self-identification questionnaire where you know you want to volunteer to give your information to CaRMS, and then you are doing this identification as a minority or so. I didn't ever really submit this thing to anyone. I just did it because it is a compulsory step here. I never really shared this page because it didn't matter and I didn't care. So you can do it if you want, but I didn't do it. Again, then you participate in the march here, and this is actually already closed. But again, before you participate in the march, you click here. The same matches are listed below, so there will be different kinds of match, but the R1 match is usually what we do. The R1 is a main residency match, and then you have all this information right here. Normally when you click, you'll see much more information, but since this is post match, I can't get it. And some declarations right there that you have to obligatory do. And then remember this one again, as I always say, and this is compulsory and you must pick it, because again, sometimes programs use this particular page to filter. Do you see this? Specify the date on which you last practiced medicine in a clinical setting. So this is recency. This is where the question of recency comes in. And you see if you're currently practicing, you check here. If you're not, then you have to include the date that you're currently practicing, for instance, May 2025. So that's a month. So again, these things really matter a lot, and then you have to agree before you can even proceed to submit your application. So, and that's called the declaration. So this is really important. So that's why people say recency matters. I do think it matters. It's not the only thing, but at least it contributes to a little bit. And then application to programs. So the way you do it, normally they used to say submit an application, and you could click here and then you would follow the instructions and just adding a programs, as you can see right here with all these different explanations where there you to consult program description before, and then to indicate whether you're also applying to the US match or not, because this is a national residency matching program for the US. You have to say that and then apply to program. Then that's how you have to apply to you can read articles online here which shows you how to apply to programs. Coming back here, you can apply, and after that you assign. Again, you can read this article. It's going to show you how to assign programs, and then you can create like a rank order list. And then the day of the match, you actually get your match, and you're told, and it says here that match, and it says here that match at the University of Calgary, and then it gives you every information. So far that has been very comprehensive, and thank you so much. If you've liked this video and you think you want to know more, please hit like, subscribe, and I'm gonna see you in the next one. But until then, bye bye. Here, peace.